Hi, I'm Dr. Keely Gales, and I'm the founder of Health for the People. I want to share with you a short story. This week was the 4th of July, and on the 4th I wanted to get a picture of my family all dressed in red, white, and blue. My 11-year-old stopped and looked at me and said, "Mom, I really don't want to dress in red, white, and blue. Honestly, most days I'd rather be in another country." And my heart broke because my 11-year-old self was one of the most patriotic individuals you ever would have met. But at that time, we were having one of the most patriotic moments in American history and really coming together around a common cry, although there were still people who were hurt in this moment. Her experience in the last 11 years, however, has been that we have just become more and more divided. We've allowed that division to prevent us from moving forward as a society. You may not know this, but in the United States, we are actually ranked lower than the majority of other developed nations when it comes to healthcare. We have worse health outcomes, and we pay more per capita to see them. I didn't know this fact until I was going to school to get my doctorate in physical therapy. And when I found out, I was very disheartened. But I didn't let it stop me. What I did was allow it to empower me to start Health for the People. And here we are years later, and I'm asking you to join me on this mission. Because I believe that as Americans, we can solve any issue that we put our mind to. And that all we need is bridge builders to help us recognize that the reality is that we actually agree on more than we disagree on when it comes to healthcare. I learned this as a provider because as I had conversations one-on-one with my patients, I could see that what I saw on the news and heard on the radio was only a very small piece of the picture. But the reality is that we all recognize that our healthcare system is broken. And the beauty is that there have been people working diligently across this nation and internationally to come up with solutions to make it better. But we as Americans have to come together and have those hard conversations to figure out how do we implement those in this country. And that is what we as Health for the People are doing. Join us in the drawing room. You can be a part of that conversation, regardless of if you're a provider or a patient or a caregiver or an executive for some healthcare organization. We need all voices to be represented whenever we devise the plan that we will be using moving forward. Because only when everyone is at the table will we be able to come up with a healthcare plan that will work for everyone. And I believe that that plan can be both inclusive and fiscally responsible, because that is what the research is showing us. So choose to be a part of the solution and join Health for the People in this conversation to create the plan for tomorrow so that my children and your children and grandchildren can have a future where they are not being held back by a broken healthcare system. Whether physically or economically, we cannot suffer through decades more of the current system. It is unsustainable. So join me and let's come up with a solution. Thank you.